now move on to the next session on lived experiences and perceptions of disability. We have two presenters in this panel, Ms. MMN Vanshani and Ms. Kumudu Hera. Yeah, I hope you all are here. Can you all just say hello if you're here?
Yes, I'm here. I'm Vanshani.
Vanshani, sir.
Yes.
Okay, let me just. Right. Will you be sharing slides?
Yeah.
Vanshani? Okay.
Yes.
I will make you a co-host.
Dr. Tharindi, if at all possible, may I please request you to make Miss Shiny the Sinhala interpreter?
Miss Shiny. Okay, I will do that. Dr. Shiny.
Thank you.
Right. Dr. Shamini, how does she go? I mean, is she? Well, I can't find her on the participant list.
Shiny, can you just identify yourself, please, so that Dr. Tharindi can.
Text to you, madam.
Shiny?
Madam, I put a messaging text chat box, madam.
I can't. I'm sorry, I can't find it. Shiny, can you please spell your name? How do you go as? Shiny.
Shiny Heva Patrinage, madam.
Right, sure. Got it. Right, I think you should be able to. Right. Okay, with that done, let's move on with the panel. Vanshani, yes, we will have your presentation first. So
Okay.
Vanshani is going to talk about perceptions on inclusive education held by parents of children living with Down syndrome. I have enabled screen sharing for you, so over to you.
Okay. Good morning, everyone. And my study was perceptions on inclusive education held by parents of children living with Down syndrome. My introduction. Parental perceptions are regarded as a crucial factor of successful implementation of inclusive education of children living with disabilities. Literature reveals that perceptions of parents of children with Down syndrome towards inclusive education and their effect on the education of those children were varied. My objects was my first general objective was to explore if parent perception have an influence on access to inclusive education of children living with Down syndrome. And there were two specific objects. First one was to explore the perceptions on inclusive education held by parents of children living with Down syndrome. And next one was to understand whether parental perception have an impact on access to inclusive education gained by children with Down syndrome. Methodology I used was, this was a qualitative phenomenological study and duration was from September 2019 to January 2020. Study population was parents of children living with Down syndrome within the age range of 6 to 18. Sample size was 15 parents of children living with Down syndrome, and inclusion criteria was parents Parents of children living with Down syndrome between the age of 6 to 18 who are attending the MDT clinic at TDS. Study instrument was a semi-structured questionnaire. I did in 2 phases. First phase was a pilot study. Questionnaire was done with participant for verify the validity, and phase 2 was semi-structured interview, mainly asked structured questions and unstructured questions, and also asked follow-up questions. Sampling procedure was purposive sampling procedure, and data analysis was done as T-Metallic method. When I talk about participants' characteristics, most of age of children were in age 5 to 10, 73.3 was in age 5 to 10. And when we consider about age of parents, most of parents were in age category is 40 to 49. And when I consider about their gender, parents' gender, most of them were female. 90% 3 was female. And when we consider about attending to school, yes, most of them was attended to in school. 93.3 were attending to school. And when we consider their class they attended, regular or special, most of them were attending to regular class. Actually, 53.3 were attending to regular classes. I used thematic analysis for analyze data, and I could emerge 3. There were 3 emerged themes. First theme was learning capacity. When I talk about first theme, learning capacity, parents see ability first, and they don't see disability as a barrier. He is able to understand most of the things when explained. The only problem is sometimes there is a need to repeat the same thing a few times. Other thing was our daughter isn't weak that much. Only the speech is little bit less. The second theme was emerged, self-reliance. Under this self-reliant theme, there were 3 sub-themes. Self-reliance. Parents believe that education lead their child with Down syndrome to an independent life. The first sub-theme was social integration. If they can cohabit in society on equal terms with others, then it was seen as the path to independence. Not being labeled. Parents strongly believe that inclusive education would prevent this labeling and negative stereotyping. And third sub-theme was imitative learning. Actually, this is kind of positive thing they see in inclusive education. Interaction with typically developing children in an inclusive education environment leads children with Down syndrome to acquire a variety of skills. Their thoughts were, I need to live alone. They need a foundation that enables them to carry out the fundamental task in their lives. He needs an education that would enable him to carry out his day-to-day task in his life. When we made him special, he becomes special. I need him to be treated as a normal person. I think it is very important to be with normal children. Then he tries to do what they do. He participated in a dance, and he danced by looking at others. My last theme, third theme, was barriers to access inclusive education. There were 2 sub-themes. barrier to access inclusive education, indicated that there are certain barriers. They suggested certain modification to the approach to mitigate these negative factors. First sub-theme was the demands of the curriculum. There isn't insufficient attention to given to children who are considered slow or incapable of keeping up this pace. And second theme was need for attitudinal change. The need for positive attitudes among teachers as well as other parents mean of typically developing children, were highlighted. When there are no trained teachers in government school, they doesn't like to accept our children. The parents, other parents' ideas was, when we look at it from an education perspective, the teachers in special unit dedicate their time and effort to other children. However, in a normal class, this is not possible because there are exams. The other idea was, it is useless to keep him in a normal class if the teacher's mentality is negative. After a few weeks, she started to cry and asked to send back to the special class. She received good care at the special unit, so she likes to go back. There is no point to keeping the child in normal class if teachers' attitudes doesn't change. And these are the themes, and this is my conclusion and recommendation. Overall, parents demonstrated positive perceptions towards inclusive education despite the barriers their children confront in accessing inclusive education. They were aware of benefits of inclusive education. Although all parents have positive perception, all children with Down syndrome does not access inclusive education. The issues are outside of parental perceptions and are more concerned to social perceptions, society and infrastructure barriers, and curriculum limitation, among other things. Taken as an exclusive factor, the positive perception on inclusive education held by parents of children with Down syndrome could be considered as a benefit of children with Down syndrome. There needs to be more exploration of overall barriers and their interconnection. And these are my references, and thank you for.
Thank you very much, Panchani. We will take questions after both presentations are done. Is Ms. Kumudu here?
Yes, madam, I am here.
Right. Are you going to share slides, Kumudu?
Yes, ma'am.
I shall make you a co-host. Right. You can try sharing the slides now. Right. So Kumudu will be speaking on communication-related experiences of employees with cerebral palsy at workplaces in Sri Lanka. Kumudu, over to you.
Okay, madam. Can you hear me, madam?
Yes, we can hear you clearly.
Yes, madam. Good afternoon, everybody, and welcome to my presentation. And thank you so much for giving this opportunity. I am from Department of Disability Studies, Faculty of Medicine, University of Kelaniya. Today, I am of employees with cerebral palsy at workplaces in Sri Lanka. My co-authors are Dr. Shamini Hettiarachchi, a senior lecturer from Department of Disability Study, Faculty of Medicine, University of Kelaniya, and Ms. Niluka Gunawardena, visiting lecturer from Department of Disability Study, Faculty of Medicine, University of California. In my presentation, I'm going to look at 7 main parts: introduction, objectives, methodology, results, discussion, conclusion, and finally the recommendation of my study. So let's start with my study introduction. In 2006, the United Nations Conventions on Rights of People with Disability determined that people with disability also have right to work and employment, which is one of sustainable development goal supported by United Nations to reduce inequality. People with disability who are in employment face many barriers during work. It could be due to lack of reasonable accommodation for mobility, fear, institutional, environmental, and attitude barriers. Employments are an expected education level, and foreign education to employment is arguably a challenge for adults with cerebral palsy in Sri Lanka. However, inclusive and equitable opportunities for individuals with disability in education are employment that value diversity within the school context and in the workforce, in translating existing policies to practice have not been forthcoming. So this study was undertaken to explore the lived experiences of adults with cerebral palsy in employment in Sri Lanka, with particularly reference to communication. So let's move into the objective of my study. The general objective of my study is to identify communication-related experiences of employees with cerebral palsy accessing workplace in Sri Lanka. And there are 2 specific objectives that are to identify the communication-related opportunities and challenges experienced by individuals with cerebral palsy in accessing the workplace. And the second one is to identify the communication-related adaptation developed and suggestions to overcome challenges by individual with cerebral palsy in accessing workplaces. So let's move into the methodology of my study. The participant of this study was supposed to be 10, but the target population could not be implemented due to unavoidable reasons with COVID-19 situations. Some of them, so my sample size was 6, and I used both purposive sampling technique and snowball sampling technique, and a semi-structured tele-interview interview guide using which is consistent of open-ended questions were used to data collection, and I used thematic analysis which commonly used in qualitative research and analysis, and I used a qualitative study using a phenomenology approach, and the participants were working in different organizations. The study population is employees with cerebral palsy who have been employed in their current job for at least 6 months and who are above 18 years old. And this study period was April 2020 to March 2021. It was 11 months. And let's move into the results of my study. As you see on this diagram, there are 5 main themes and 12 sub-themes were identified according to the data analysis. But I am not going to look at each of every separately. Here I am targeting the themes that imaged about accessing employment. Communication is important as it underlines all aspects of life. It supposed to increase educational achievement, enhance employment option, greater community inclusions, and improve quality of life overall. But employees with cerebral palsy face many barriers, many communication-related challenges in accessing employment. One of them emerged during analysis was discrimination. People with disability have not opportunity as equally as non-disabled people in Sri Lanka. Individuals with cerebral palsy in this study revealed that there are lack of understanding of disability which made it difficult to find offering employment even they have much more qualification, and that stereotype in our stigma related to disability. Individuals with disability are being excluded or overlooked when it's come to hiring employment. For an example, one of participants has said that due to poor communication skills, it was challenged to access the employment even he has much more qualifications. When consider the communication, some of employees with cerebral palsy have difficulty in control their muscles in their face, throat, neck, head control, and leading to poor speech development and a lack of intelligibility, result in significant barriers to communication. Which as I previously mentioned, communication skills are among the variety skills perceived to be prerequisite ability for employment, as especially for unfamiliar person, difficult to understand their speech via phone, are the communication challenges that emerge during data analysis make difficult to access in employment. It could be been long time unemployment and employee in short period of time in certain company. And third main theme of communication related challenges at workplaces is self-confidence. It is correlated with intelligibility of communication too. If the co-workers employer accept their community differences is make self-confident. For an example, a participant said that they don't like to talk with others until they get used to with people. It is very supportive if when co-workers accept their strengths and weaknesses. To overcome these communication breakdowns, they have used some strategies, deliberate use of repetition, use of other communication format. As previously said, if employer, the co-workers accept their communication differences, it is easy to access the employment. And if not, it is very challenge. It is a challenge to access employment. The participant of my study highlight that some suggestions to increase access of employment as access of employment as an employee, they require to use communication laptops for everyday job tasks such as emailing, typing, etc. It could be difficult to employees with cerebral palsy, so technical support is very important. For an example, one of my participants has told that he already used some software like Dragon software for speech text typing, and he suggests that increase some other software to make easy access for employment for other disabled peoples too. And also, one of my participants have done his higher education in abroad, and he told that in those countries, people with disability gets technical support support from their child, and it makes it easy to access employment, and it suggests to provide technical support for people with disability from their childhood in Sri Lanka. Other suggestions is provide inclusive education. For an example, one of participants said that people with disability should be considered to a classroom environment as better empowered. Participants said that since we learn in mainstream classes from childhood, we got to know how to interact with non-disabled people and how to speak with them. So inclusive education.
I think we
Sorry,
lost
madam.
Kumudu. Yes, your screen sharing stopped. Would you try to share it again?
Okay, I will try it.
Right. Yes, we can see. Please continue.
Okay. One of participants said, oh, okay, thank you, madam. One of participants said that see how to interact with non-disabled people and how need to speak with them. So inclusive education, support for accessing employment. Receiving speech therapies, other important suggestions, image during analysis. Receiving speech therapy is one of important suggestions image during analysis. As participants said, speech therapy should be implemented from early in their life and continue a support system until successful communication at the workplaces would support for access to employment. So increase the awareness of speech therapy services is very important because it is relatively new profession in Sri Lanka. So let's move to the discussion of my study. The study done by in 2015, individual with cerebral palsy in his study were in aggregate employment or participation activities, and that is about stigma related to disability. And also a study done in 2013 that a system is an advantageous to workplace needs for individual with disability. Access to an efficient, effective, and appropriate means of communication for both work and social pursuits is vitally important in the workplaces. And also, according to the research done in Kansas, was highlighted
Kumudu, we lost you again.
I am really sorry, madam, poor internet connection. A study done in 2013 revealed that is an advantageous to workplaces needs for the individual with disability, access to an efficient, effective, and appropriate means of communication for both work and social purpose in vitally important in workplaces. And according to research done in Kansas, was highlighted that some employees who have speech difficulty are isolated in the workplaces, and they have most difficulty to having conversation over phones. The study done by United Nations, the study has highlighted that some employees with cerebral palsy use some strategies to cope with communication breakdowns at workplace. When they have experienced communication breakdowns, they repeat and repair the communication breakdowns, but they didn't know how fair it was for the listener. Using technical support for communication can be potential to support communication needs and wants, develop social relationship, and exchange information faster and with greater reach that ever for. And these are the discussion of my study, and let's move on to the conclusion of my study. Negative and stereotype perceptions toward persons with disability affected recruitment even when the adults with cerebral palsy had much more qualification than others. Main participant concern is intellectuality of speech that results in limited participation in employment. Due to intelligibility of speech, all the participants have faced challenges, made adaptation, and have made remedial suggestions. Individual of speech and self-identifiable major concerns the participation identify as a challenge they have faced workplace, and also the communication related opportunities depend on education level and type of employment, depend on action beyond. The suggestions given by employees with cerebral palsy were to increase technical support, provide inclusive
I think we lost Kumdu again. Yes, Kumdu's back. Like,
I'm really sorry, ma'am.
yeah, please wrap up. Your time has
And the
over.
and my recommendation of my study is the perception of employees with cerebral palsy could help to make recommendations toward those who are providing vocational services to employees and in job readiness to meet the employees' expectation within Sri Lankan context, and their perceptions could help make recommendation for better speech and language therapy service provisions for this clinical population in Sri Lanka. So is my references. I used. Thank you so much.
Right. Thank you, Kumudu and Vantini, for your very insightful and thought-provoking presentations. I would like to open up for questions if there are any. Audience. Any questions?
Hi,
Yes.
Kumudu. One question. I just want to know, in your study, you identified that if the students with disabilities are provided technical support or technical knowledge, that they will be able to perform better at their workplaces or be employed. Were you able to identify the type of technological support? What type of technological support did they mention? Did you sort of go into sort of details there?
Actually, sir, we can use ASC system. In other countries, they use some people who are working in places use ASC system, but But in Sri Lanka, the people with disability in employment didn't use AAC system. So we can introduce low-tech AAC system and high-tech AAC system to communication with others, and it will make better to communication with others.
Thank you very much.
Okay. Yes, sir.
Thank you for that question. Any other questions from the audience? Vanshani, any questions for Vanshani? If not, I will quickly ask a question from Vanshani. I mean, Vanshani, I was very interested about your presentation on Down syndrome students and the idea perceptions of parents on their education. Could you maybe explain a bit more on how education was envisioned to give to people with Down syndrome a independent life?
Yeah. Independent life. Most parents' perceptions in teams also, it was illuminated. They think that they can have independent life if they have education. I think if they have education, they can enrich with independent economically independent, and I think if they have a good education, they can have independent with their thoughts also. They can have a wide range of thoughts. Also, then they can be independent in their thoughts, and economically also they can independent. And I think socially also they can independent, because they can participate social things very well if they have a good education. Yes, I think in economically and thoughts and socially they can independent if they have education.
Right. Thank you, Vanshani. There's a question for Kumudu. What can we do to enable better access to work for people with cerebral palsy?
In here, I targeted on the communications of employees with cerebral palsy, so we can give speech therapy for them to increase the intelligibility of speech and good way of communication. So I think we need to increase awareness of speech therapy with people with disability around among the people with disability, so they can will it will help to access in employment.
Okay, thank you, Kumudu.
Thank you.
Yeah, again for Vanshani, you spoke about barriers to education, and you mentioned that the curriculum were a barrier. Were you able to find out like how the curriculum should change? Like, do you have any recommendations to accommodate people with
Yes.
Down?
Yeah, they mainly mentioned that curriculum was a barrier. As I think we can give them IEP for overcome this situation, and IEP, and we can give speech support like speech therapy, and mainly we can give IEP for them overcome these barriers, curriculum barriers. And mainly I didn't find what other facilitative things I didn't find mainly.
Right, Vanshani. Could you explain what IEP stands for?
Individual education plan. Do I need to explain it?
Yes, in a few
Okay.
words.
Okay. Individual education plan is we find out what are the barriers and what are the abilities of the child, and we give recommendation what are the things we can make for individual for this child for have better education.
Right. Okay. Thank you, Vanshini. We have another question for Kumudu. How important is employer and peer sensitization when it comes to the employment of persons with disabilities?
Sorry, madam, I couldn't hear that.
How important is employer and peer sensitization when it comes to the employment of persons with disabilities?
As mentioned in my study, some of my participants reveal that when when the colleagues know how what are the difficulties they have, how to treat them, how to assist them, it is very supportive for them to work with colleagues, and also it is very helpful for colleagues to work with in employment, and they would prefer to work in employment with the support of the colleagues.
Yeah. Okay. Thank you, Kumudu. I hope that's a sufficient answer for the question. Right. Just a follow-up question, Kumudu. What kind of employment were your respondents in?
Actually, all the participants on my research was in working in private sector, and there are 6 participants, and 2 female one, and others are in males, and there are some there is one who is Minister of Sri Lanka Youth Parliament, and a volunteer work in United Nations in Sri Lanka, and bank employee, and who gives support for information technology, and others are in customer services, madam.
Right. Thank you very much, Kumudu, and thank you very much, Vanshini. I think that with that we can bring the session to a close. If there aren't any further questions from the audience. Right. Good luck with your further research and further career progressions, Kumudu and Vanshini. I hope you get the opportunity to research more on these areas and come up with better recommendations and suggestions to improve inclusion
The cow missing.
in Sri Lanka.
Okay, thank you so much,
yeah.
madam.
Thank you very
Apa
much,
duty
and Vanshini.
නෑ නෑ පැතුම් වෙන්න ඕනේ නෑ මොකද යා මේකේ නෑනේ